Hello everyone and welcome to the clinical pharmacology unit, and today we are going to speak about the last part of the reproductive female hormones. We're focusing on the six hormone estrogen and progesterone, and the last section will be focusing on the oral or like hormonal contraceptives. So hormonal contraceptives include the oral contraceptive, combination of oral contraceptive and transdermal patch, vaginal ring, progestin-only pills, injectable progestin implant, and then we have a progestin intrauterine device. Someone may ask how this hormone work, how this hormonal contraceptive work. Here we are talking about the mechanism of action. Estrogen provide negative feedback on the axis that will lead to the inhibit release of FSH and LH secretion, and this will lead to the preventing of ovulation. So you can see here the result will be prevent of ovulation. So our medication here, the estrogen, will practice negative feedback on the FSH and LH, and this will lead to the prevent ovulation. In addition, what they found there, progestin thicken the cervical mucus, and this will hampering the transport of sperm. So we have two main mechanisms: estrogen, progesterone, practicing negative feedback on the FSH, LH. In addition to the progesterone, thicken the cervical mucus and hampering the transport of sperm. Okay, so here we have adverse effect or unwanted effect related to the hormonal contraceptive. We have common adverse effect. It's like popular in practice. You can see like breast fullness, fluid retention, edema, headache, nausea. This is popular. We have some side effect relative to the progestins. Progestin may cause depression, decreased libido, acne, hirsutism. So progestin may cause this side effect: depression, change libido, hirsutism, acne. What about estrogen? Estrogen increased risk of thromboembolism. Estrogen increased risk of thrombophlebitis. Estrogen increase myocardial infarction and stroke. So all these related to the hormonal contraceptive. And also we need to mention here the risk for in breast cancer and endometrial cancer related to the estrogen therapy. Okay. What type of hormonal contraceptive we use? We have something called monophasic, then we have multiphasic, then we have progestin only pill, postcoital emergency contraceptive, transdermal patches, injectable progestin, and progestin implant. So we'll start with the first one here. For monophasic pill, what we have here, the pill contain constant dose of estrogen, progesterone. This is a key word for us here. I will go with the highlight, screen pointer, highlight. So what we have here, we need to remember monophasic pills. We have constant dose of estrogen and progestin, and one tablet taken every day for 21 days, followed by 7 days break or placebo. As you can see here, we have fixed dose of estrogen and progesterone uh, for the 3 weeks, 21 days. Then we have placebo, and for another 7 days, this will induce withdrawal bleeding. So monophasic, we have constant dose of estrogen and progestin. Regarding the multiphasic pills, the pills contain constant amount of estrogen. So the pills contain constant amount of estrogen, but we have increasing dose of progestin to mimic the female menstrual cycle. So you can see here we have multiphasic. Start with the estrogen, then we have estrogen progesterone, then we have progesterone only, then we have placebo. So we have constant amount of estrogen, then we have increasing dose of progesterone, try to mimic the natural female cycle. Regarding the progestin pill only, so what we have here, we have only progestin in the tablet, and we call this one progestin only pills, and this will be given for 21 days. As you can see, we have the pink color here, all these progestins, but they said this type of progestin pill only, less effective than the combined pill. Uh, Another pill available for the emergency contraceptive or postcoital emergency contraceptive, single dose of levonorgestrel. Single dose of levonorgestrel, we have it like Julia here, and we have another one like alibristal. We are going to speak about later on about that. Another methods for contraceptive, we have transdermal patch. Transdermal patch contain both estrogen and progestin. Transdermal patch, and used for 21 cycle day. Okay, if we use one batch for 21 cycle day, applied for each week for 3 weeks, then we remove the batch for week number 4. So we apply the transdermal batch for 3 weeks, then we remove the batch with the during the week 4. Okay, during the 4th week. Injectable progestin, we have medroxyprogesterone. You can see that the pharmaceutical form, injectable progestin, this provide contraceptive for 3 months. This is cover the hormonal contraceptive, maybe provide efficacy of hormone contraceptive for 3 months. Will be enhance the compliance of the patient, because we need only one injection every 3 months. The last one here, we have progestin implant, and we maybe insert the implant under the skin, and this over contraceptive for 3 years. So the question here, we have multiple methods of hormonal contraceptive: monophasic, multiphasic, progestin only pill, postcoital emergency, transdermal patch, injectable progestin, and then we have progestin implant. The question here: which of the following hormonal contraceptive provide contraception up to 4 years, for up to the 3 years? So I will go with the progestin implant. Which of these hormonal contraceptive provide contraception for 3 months? I will go with the injectable medroxyprogesterone. Which of these medication provide emergency contraception? Levonorgestrel, 1 tablet. Okay, so and so on. Okay, what type of combination we have in the tablet oral contraceptive? As you know that we have. Okay, again, let me change the pointer to the pen. As you can see here, we have combination treatment and the oral contraceptive between estrogen and progesterone. And the most common estrogen in the combination, we have ethinyl estradiol as estrogen. And regarding the progestin, we have norethindrone, could be levonorgestrel, could be desogestrel, could be norgestimate or drospirenone. So we have several type of progestin will be in the tablets, not only one. Could be norethindrone, levonorgestrel, desogestrel, norgestimate, drospirenone. Okay, so we could discuss the combination oral contraceptive. Then we move to the transdermal patch. For transdermal patch, here we have two combination. We have ethinyl estradiol as estradiol. Then we have progestin norgestromine. The progestin norgestromine, and this will cover for 28 day cycle, and we use one batch every 28 days. We apply it for 3 weeks, and we remove it in week number 4, and this will lead to the withdrawal bleeding at week number 4 between the days 21, 22, and 28. Okay, the transdermal patch, they found that the efficacy of transdermal patch is less than effective than oral contraceptive. So the efficacy, the transdermal patch has efficacy similar to the oral contraceptive, but they found this patch is like less effective in women that more weighing than more than 90 kilograms. So we need to maybe address this one here. Transdermal patch comparing with the oral contraceptive is similar efficacy, but the transdermal patch is less effective in women weight more than 90 kilograms. Okay, we need to remember from the slide what type of progestin we are going to use. We have progestin norgestromine for the transdermal patch. Regarding vaginal ring, for the vaginal ring we have ethinyl estradiol, then we have etonogestrel. Vaginal ring inserted in the vagina and left in place for 3 weeks, and this one remind us with the patch the same. The transdermal patch will remain for 3 weeks. Vaginal ring remain for 3 weeks. After 3 weeks, the ring will be withdraw because this ring maybe it's carry the hormone ethinyl estradiol and etonogestrel. This is number one for vaginal ring, ethinyl estradiol and etonogestrel. What about progestin only pills? Progestin only pill, we call this one mini pill, contain progestin and normally norethindrone, administered daily to deliver low and continuous dose of the drug. Continuous daily, less effective, may cause irregular menstrual cycle. This will be used in patients who are breastfeeding. Unlike estrogen, progestin do not have effect on milk production. So which one of these oral contraceptive will be prescribed to the breastfeeding during breastfeeding? We have progesterone only pill or norethindrone, the mini pill. We use it during lactation. So this one use it during lactation. We need to remember that. Norethindrone, progesterone only pill, less effective, may cause irregular menstrual cycle. Okay, regarding the injectable progestin, we have Depo-Provera. We are going to maybe review the website. So what we have here, injectable, we talk about injectable. This provide effective contraceptive for 3 months. Could be subcutaneous or could be intramuscular contraceptive, and the brand or the generic medroxyprogesterone, the brand name Depo-Provera. This product provide high sustained level of progestin for 3 months. Patient may suffer from amenorrhea, patients suffer from the delayed return fertility, weight gain, and may cause bone loss and predispose patient to the osteoporosis. I would like to click on the medroxyprogesterone information. Okay, this is what we have here. I will share the screen with you. And this many maximize. So this one here, Depo-Provera, medroxyprogesterone acetate, injectable suspension. And what we have here, they said Depo-Provera. Okay, so we look on the risk of osteoporosis. We can type here Control F, osteoporosis. You can see it here. It's unknown if used osteoprovera and other sense early critical period will reduce the peak bone mass and increase risk of osteoporosis or osteoporotic fracture in later life. If you click again, okay, again, and they said here we have studied said maybe demonstrate that Depo-Provera may decrease bone mineral density. So we have several maybe topics about Depo-Provera injectable every 3 months may cause a risk of osteoporosis and fractures. Okay, progestin implant. Progestin implant, as you can see in the picture here with the references, after subdermal placement of in the upper arm, we have progestin only. This name etonogestrel implant. Etonogestrel implant. This will provide contraceptive for 3 years. This one reversible, long-acting reversible contraceptive, LARC, long-acting reversible contraceptive. Progestin implant and intrauterine device are known as LARC. This will stand for long-acting reversible contraceptive. We have 2 methods here in the slide. For LARC, we have progestin implant, we have intrauterine device, may provide contraception for the 3 years. Okay, regarding the postcoital or emergency contraceptive, the most common used a single high dose of levonorgestrel. This is a postcoital emergency contraceptive. The most common form will be levonorgestrel. Levonorgestrel is like kind of progestin. Should be taken as soon as possible after unprotected intercourse within 72 hours. So we recommend to do this one during the 72 hours. So other option we have it there. We have alibristal. You can see it here. Another medication. Alternative emergency contraceptive is progesterone agonist antagonist. Alibristal indicated for emergency contraceptive could be taken during 5 days of unprotected intercourse. So we have two approach. Number one, we have levonorgestrel 1 pill, postcoital emergency pill should be taken during within 72 hours of unprotected intercourse. We have alibristal we have the margin for 5 days to be taken to protect from a pregnancy, unwanted pregnancy. At the end of this lecture about reproductive female hormone, this slide here summarizes the information about the sex hormone in general. We discussed the estrogen with you. Okay, we go back again. We just discuss the estrogen, selective estrogen modulator, progesterone, and the next lecture will be focusing on the on the reproductive male hormones. We are going to discuss later, but we have some, for example, mifepristone here. We have danazole. It's already covered in this lecture here. Okay, so the representative application for gonadal hormones antagonists here. We have some clinical use for this medication, and we covered endometriosis, we cover breast cancer, osteoporosis, infertility, uterine bleeding, postcoital contraceptive, oral contraceptive, and hormone replacement therapy, hypogonadism. We cover the hirsutism, prostate carcinoma. We will be covered in the next lecture. This will conclude our lectures about the reproductive female hormone. We cover a series of topics, start from estrogen, progesterone, SERM, then we have oral contraceptive, and we discuss the menopausal symptoms treatment with the algorithm, with the guidelines. I hope this series of lecture will be useful for everyone who is listening and watching this channel. Thank you so much and have a great day.